How was your process to choose the theme of your thesis when you were about to graduate medical school?
So I think the first thing to do is understand what you like. So once you understand the 2, 3 things that you enjoy, maybe it's just one specific specialty, you can then maybe liaise with your professors.
Hello you guys, welcome to this channel. My name is Matt. I'm a medical student here in Rome, Italy. I have this joy to share with you my journey here as a medical student, as a father, as a husband, as also a worker, humanitarian worker. I have been working for the past 10 years with international development, and I want to share with you my story.
So today I have a very special guest on my channel. He graduated in 2021 in medicine and surgery from the University of Rome, La Sapienza. He completed his first year of the Foundation program in the UK. He's from Brazil. He got accepted into one of the most competitive public medical schools in Brazil, and then decided to leave everything behind and move to Italy to start all over again and study medicine in English. Besides being a doctor that graduated with honors, he's also a great friend that I had the privilege to meet in Rome during my first year of medical school. Welcome back to our channel, Dr. Guilherme Veronesi.
Hi, Matt. Pleasure's mine. As I said, I'm glad to be here. Always a pleasure chatting with you. So, yeah.
So today we will actually continue on the previous first part of this interview that is now talking about the UK Foundation program. But before going to the UK Foundation program, I want to ask this question of the $1 million. How was your process to choose the theme of your thesis when you were about to graduate medical school? It's a very scary topic for a lot of medical students. So explain to us how actually was your process and how can we actually start thinking about it right now?
Well, I didn't understand where to start. That's the point, right? When I was looking into it. So I think the first thing to do is understand what you like. So once you understand the 2, 3 things that you enjoy, maybe it's just one specific specialty, you can then maybe liaise with your professors and see who within your professors would be willing to take you for a thesis. So I suggest you start looking into this maybe during your 4th year, not because you need to start then, but because you can then have an idea of what you need to do. Some doctors, they ask you to spend some time in the department before you go on to do the thesis with them. So this process can take 6 months sometimes, a year. It depends on the professor. So basically, after you've decided which specialty you want to do your thesis on and which doctor you're going to do the thesis on, and that's one of your professors within that subject, you can then discuss with this doctor, and once they've accepted you with doing a thesis with them, you can then discuss a topic. Choose a professor, understand what you need to do in order to do the thesis with them. Maybe you need to spend time in the department or not, and then discuss the topic and the project with them. And then you can get onto it, yeah. The theme of my thesis was cardiac injury in humans with SARS-CoV-2 infection. So basically, my thesis was done during the height of the COVID-19 pandemic. And my supervisor, he had a very interesting project in which he was analyzing pathological samples of the heart of patients that had died from COVID and that had died from cardiac causes as well. And we wanted to understand the presence of the virus within that tissue. And then we went on to analyze the histological samples and everything. It was very interesting. I think it's a good experience for you to get some scientific some exposure, right, to work on your writing up, because then you have to write up a scientific project with an appropriate introduction, review of the literature, methods, results, as if you were writing an article, right? And it's also an interesting opportunity for you to get more in touch with the specialty that you enjoy. It doesn't need to be something set in stone. So just because you chose a topic for a thesis, you don't need necessarily to then pursue that as a career, but it's a good starting point. And I think it kind of it kind of sends you off in a direction or shows you that's not what you want to do. So it gives you a good idea of that specialty. Yeah.
And so after your thesis, then you decided to pursue cardiology, and then you applied to the UK Foundation program. Is that correct?
Yeah.
What are the general tips that actually would you give to somebody that would like to apply for the UK Foundation program?
So tips, first of all, understand the regulations, because this is something that changes every year or every so often. So go on to UK Foundation program, throw that on Google. I'm not sure the name of the website, but it's the UK Foundation program, and they will have everything the applicant needs to know. So they'll have the applicant's handbook, the guide, all the dates that you need to follow with deadlines. But basically the application consists of you applying for the foundation program itself. Okay, and that consists in you, your score is divided by your curriculum and your CV, and your score in a test called the SJT, which is basically an abbreviation for situational judgment test. So this is not a clinical exam. It's just a bunch of questions about situations that may arise in a hospital setting. It talks about how you would behave within a hospital setting, with your colleagues, with the patient, in situations that are a bit adverse. So it's basically to understand how you are as a professional, not as a clinician. Tips: read about how things work in the UK. The SJT, because it's a very, it deals with specific situations, it's important to have understanding of what the UK system is like. So they will make references to SHO, Reg, Consultant. Those are basically the different grades of the doctors in the UK. And then if you're reading a question and you have no idea what those are, how can you answer correctly, right? But it is something that is kind of natural to someone that's been in the UK system. So understand how the UK system works, do some mock exams that they provide in the website. About the CV part of things, you get extra points if you have publications that are listed on PubMed. So if you get the chance to do that, that is definitely advisable and definitely a good thing. Overall, it's a good thing, but also worth it for applying to the UK. And the second branch of the application for people that are coming from outside the UK is the eligibility application, which basically will give you the right for a visa, for a work visa in the UK. So you should start looking into those things at the end of your 5th year. That's usually when the applications open, okay? So usually right at the beginning of the 6th year or at the end of the 5th year. And the whole process takes around 1 year. Definitely go check it out on the website. It's good to be prepared, yeah.
Okay, and then backtracking a little bit. So we talked about your thesis. You did experimental thesis in cardiology. And then you left actually thinking, well, now I'm considering cardiology. Then you got into the foundation program that is it's a different process that you have to do 2 years of foundation program, and then what would take for you to become a cardiologist within the UK?
So then after those 2 years of foundation, I would have to do 3 years of internal medicine training. So that's basically you work in several different rotations within the realm of internal medicine. So acute medicine, different clinical specialties within that subject. And after those 3 years, you'd go on to another 5 years of cardiology training. So training that specifically focused on cardiology. You'd still be doing some on-calls in the hospital, or may I say many on-calls in the hospital, working in internal medicine as a whole. But your training and your rotations will then be kind of focused on that specialty.
So you left Rome, graduated with honors, and got accepted to the UK Foundation program. And you are a very high accomplished person, and this is already a very high accomplished pathway that you're taking so far. And you had this desire to pursue cardiology. Are you right now in your second year of UK Foundation program in the same direction, going into cardiology, or what changed after completing your first year of the UK Foundation program? Help us to understand this process of choosing a specialty in medicine.
Yeah, no, some things changed. Thanks for the flattering words. I don't know if I follow in all of them, but something has definitely changed with regard to my where I want to take my career. So basically, my goal was to do cardiology, but this was something that I had. So I came to the UK with the idea that I was going to be exposed to several other rotations, to a new system, and I understood that this could influence my decisions. This is something that I actually took into consideration when I came here. It was part of the, if you will, one of the features of in a general program like this, right? And I think it's a good thing, because then you can understand things that you like and things that you don't like about the actual job, which sometimes in Italy we get little exposure to because we're too focused on that one specialty that you're doing the thesis with. Here I started thinking a lot about what I like as a person, my interests in life, and how I can kind of couple those with my work. And then obviously you also get into the work-life balance discussion. And I started getting into psychiatry because I started understanding the ambiguity of psychiatry and how human factors play a role in it. And I started to understand a lot of my personal interests would go well with that specialty. And I thought, okay, I'm gonna have a psychiatry rotation. Let's see how that goes, and I can decide then. And I loved my psychiatry rotation. It was actually a very good one, in which I had a good time. I thought the subject matter was very interesting. The patients are incredibly fascinating, and the human material is just so complex. So right now, I think if I had to choose, I would choose psychiatry. But yeah, I think psychiatry is a very interesting career, and I believe I'd be happy if I did it, and professionally accomplished as well. So I think I'd feel satisfied doing it. Yeah.
That's really awesome. That's such a great surprise.
Yeah.
Like changing from cardiology into psychiatry.
But cardiology is still very interesting. I still find it a fascinating specialty. It's just that, I don't know, right now I have a different focus, yeah.
So how sure are you about psychiatry? Are you like, there's a percentage between cardiology, psychiatry going on?
Look, when I finished med school in Italy, I was like 80% cardiology. Now I'm 80% psychiatry. Let's see after the second year. We'll be, yeah.
That's really exciting. I'm so excited for your career, Dr. Guilherme, and
Thanks.
I'm really excited to actually see the unfolding of the second year of the UK Foundation program, and also making a decision for the next steps in your career. Thank you so much for being here today with us, and thank you so much for the block 1 and the block 2 of this interview, where you talk about your medical studies, and then the beginning of your medical career, and also choosing a specialty. Thank you so much, and I wish you just like succeeding in your career and becoming an excellent doctor that I'm sure you already are. And yeah, I'm here to keep supporting you, encouraging you, and see where actually you're gonna be. And you are an inspiration for a lot of people and for me.
Matt, thank you so much. Again, your words are too flattering, more than I deserve them for sure. And but thank you so much. And what you're doing is also really beautiful, and it's really precious for everyone that's looking into getting into med school, that wants to maybe explore different pathways. Maybe there's something that there's not a lot of information available online yet. So congrats about everything you've been doing. I know how diligent you are and how applied you are to medicine and to everything you do. So always a pleasure to talk to you, and I'm sure we'll speak soon.
That sounds great. Thank you so much.